KPBS On Demand is supported by UC San Diego's Art Power, presenting cellist Joshua Roman, performing from his album Immunity, alongside music by J.S. Bach and more, Sunday, June 22nd at UC San Diego's Epstein Family Amphitheater. Reserve your tickets at artpower.ucsd.edu.
Welcome back to the KPBS Cinema Junkie podcast. I'm Beth Accomando. It's Friday, so that means another horror-themed episode for you. I got a question for you. How many of you ever snuck a look at a medical book with its explicit photos and illustrations of disease or deformities? I know, it half grossed you out and half fascinated you. You didn't want to look, but you had to. Well, that's at the root of horror. You're seduced and reviled simultaneously at times. For today's special horror-themed October podcast, I want to stray a little bit from movies to introduce you to two things. First, to Jesse Merlin, aka Mr. Horror Musical, and to the Surgeons' Hall Museum in Edinburgh, Scotland. What do these two things have in common? Well, in 2012, Merlin, who had been playing the character of Dr. Hill in Reanimator the Musical in Hollywood, went with the cast and crew to Scotland to partake in the annual festival Fringe. Being an ardent fan of Reanimator the Musical, I naturally followed them to Scotland. That's when Merlin told me about the Surgeons' Hall Museum. Let me begin by introducing you to Jesse Merlin and his unique skill set, so you can see why he's the perfect person to take us on a tour of Surgeons' Hall Museum. What do a reanimated deviant surgeon, cannibalistic serial killer, and a Max von Sydow-inspired Catholic priest all have in common? Well, they're all characters in musical plays inspired by horror films, and they're all played by the classically trained opera singer, Jesse Merlin.
What becomes of the human brain when vital function cease? Vital function cease.
Merlin looks like a caricature of a young and untanned George Hamilton, and has a bass baritone voice perfect for Gilbert and Sullivan. Since that's not what Hollywood's looking for, Merlin had to scare up roles elsewhere.
I've just become Mr. Horror Musicals lately. It was Dr. Hill and Reanimated the Musical, and then I was Hannibal and a bunch of other roles as the Swing in Silence the Musical here in L.A.
Recently, he played a comic version of Max von Sydow's Catholic priest in a Hollywood Fringe production called Exorcistic, the rock musical parody experiment.
I was a little scared by making my entrance as the priest with a hip-hop number.
Don't need show and tells, don't need four-star hotels. You just need a weatherman to tell you which way the storm dwells. Psychokinetic, frenetic, eclectic, diabetic, prophetic, and always sympathetic. It's a home sweet home now. Home sweet showdown. Home sweet throwdown. Your daughter feeling low down? Don't fret now, child. The Exorcist.
The Exorcist!
The Exorcist in the motherfucking house.
This is a guy who began singing opera professionally at 22.
I think it's ironic because now that's my selling point. That here I am, this highfalutin, snooty, ridiculous opera singer, having to wade into the entrails of a rock musical and not just do hard rock and perform with a four-piece, just really cooking rock band for the first time, but also lay down the beats and freestyle a little bit.
Let's leave the projectile vomit of Exorcistic behind and move on to the blood splatter of Reanimator the Musical. Merlin plays Dr. Hill in the horror musical based on Stuart Gordon's 80s cult classic. Dr. Hill is a lecherous surgeon who literally loses his head and reanimates from the dead.
There's a decapitation on stage, then I have a puppetry rig where I'm carrying my own decapitated head around while singing.
I loved you, and I love you still. It's time to feel the touch of the new improved Dr. Hill.
With a good head on his shoulders and another in the prop room, Merlin saw an opportunity to exploit something he's always loved to do.
I discovered early on that playing a villain is about the most fun you can have as an actor. When I got to Reanimator, for example, playing a decapitated zombie pervert was just like the role I feel I was born to play.
That brings us to horror musical number 3. Merlin got to understudy and eventually play the role of Hannibal Lecter in Silence the Musical.
I'd like to tell her I don't care, but something in her eyes. I'd like to tell her life's not fair, but right above her thighs. If I could help her solve this case, perhaps they'd let me leave this place for one that has a bit more space. I want to see a tree. Lonely, lonely lunatic. I'm charming, but I'm also sick. I need an audience for my shtick. Perhaps it could be she. If I could smell her cunt, if she would grant my simple little wish, I could illuminate this dungeon with but one small whiff of tuna fish. I'd give her what she wants, if I could smell her cunt.
I've kind of thought about what about opera, and particularly Gilbert and Sullivan, which is, a big part of my background too, leads me to horror. I think it's a grounding in over-the-top archetypal stock characters, extreme characters. I think horror is a place where actors who are offbeat, who don't look like models, who don't look like an obvious, easily marketed character type, someone who's a little average or unusual looking, or has an unusual talent, will find a place in horror where maybe nowhere else really has a place for you.
So that's Jesse Merlin. And one summer day in 2012, he decided to take me on a tour of the Surgeons' Hall Museum in Scotland.
And appropriately enough, here on Hill Square, on Hill Place, is the Royal Surgeons' Hall, the Royal College of Surgeons at Edinburgh University, which is one of the first surgery universities in the world. A really remarkable museum that's one of the very few pathology collections open to the public. And the first place I came when I got here to perform Reanimated the musical. So it feels like Dr. Hill's classroom, and it feels like Hannibal Lecter's kitchen. And that's the next role I'm playing in the Silence of the Lambs musical. So there seems to be a theme. I'm starting to think I should have gone to med school. I play nothing but evil doctors. So I hope you enjoy it. This is a beautiful place.
But before we go inside, let me take a little side trip to the offices of Chris Henry, who was Director of Heritage at the Royal College of Surgeons in Edinburgh. This cheery man knew everything you ever wanted to know about the museum. So let me digress from Jesse's tour for a few minutes to get some background on the museum and what it does.
Well, Surgeon Hall Museum is really an extension of Royal College of Surgeons of Edinburgh, and it's a museum which is built in 1832 to display human specimens, which originally held for teaching purposes, but it encompasses much more than that. It encompasses scientific instruments, art, and dentistry. So it's a sort of wide-ranging, surgically based museum which welcomes the general public as well as medical specialists.
And explain a little bit about how the museum is kind of divided up and what kind of things people would find here.
Yeah, well, it's an odd place. It's linked, really. The main building, which is called the Playfair Hall, named after the architect William Playfair, is, as I said, was built in 1832, and that was originally designed in 1832 as a museum that held the medical specimens. So, for the main part, within that area, you have an upper and lower floor. The lower floor is mainly open to the public, and that shows specimens can range from anything from a brain in a jar to art by the famous Napoleonic artist Charles Bell. That part follows themes normally based around anatomy or disease, a particular kind of pathology. And then next to it, joined by a small staircase, is what's called the History of Surgery Museum, which really takes you from the start of the incorporation of barber surgeons in 1505 right up to the present day, and talks about surgical techniques, really more about the technology, but it covers things like ophthalmic surgery, which is surgery of the eyes. It talks about plastic surgery, and we also deal with things like cardiac, and we have our special exhibitions in that area, and the one at the moment is about the famous surgeon Joseph Lister. But there's also, joining that, a separate museum, really, which is a small museum based around dental surgery. The key thing about that is that the dental collection was started by a gentleman called John Menzies Campbell, Mingus Campbell, as you say in Scotland, and he was an avid collector of all things dental. So you've got everything from famous paintings of people like Bartholomew Ruspini, who was a London dentist, and to things that you use to elevators and things you use to pull teeth out, drills, all those things that everybody wants to run a mile from normally, but generally when it's behind a glass front, then you're all right. You're much safer to look at it. Almost all the paintings that we have depict some form of removal of a tooth with lots of blood and grimacing, and I think in the early period, certainly from the sort of 16th and 17th century, it was a traumatic experience for anybody. But then I suppose you balanced the pain of your toothache against what the dentist could do for you.
Now, the use for the museum or for the specimens that are here seems pretty obvious for students.
Yeah.
But for the general public and people coming in, why do you think it's important to have exhibits like these for people to come see?
Well, first of all, it's really all about understanding the human body. Very few people see what's inside themselves over their lifetime. You might cut yourself and see a bone or something like that. But you generally don't have an idea. You can look at as many books as you like to see human anatomy, and you can look at computers, but there's nothing like actually seeing the real thing, even though it's preserved in a jar and it lost its colour. I mean, it's a strange thing because on the one hand there is a tendency to be voyeuristic about these things, but on the other hand there's an absolutely undeniable fascination about the human body, and we find that people coming in here, even if they're in part squeamish, very soon become quite used to seeing things. But there's more than that. It's really about an understanding. How does the body work? It's a fascinating machine, an organic machine, which has so many different facets to it that we just can't help but want to see inside ourselves. And I think from the public, that's one of the big draws. But there are also a number of other draws which are really about people that have been associated with surgery, and there have been quite a few. I mean, if we start at the very beginning, we talk about James IV of Scotland, who was himself interested in surgery and actually carried it out on occasion. Though what happened to his patients is not generally well known. But also we have people like in Scotland, Burke and Hare are the two individuals who murdered 16 people to get their bodies so that it could be used for anatomical dissection. But a lot of people don't know also that one of the key figures in the history of the college, in a way, was a surgeon called Joseph Bell, upon which Sir Arthur Conan Doyle based his character of Sherlock Holmes. In fact, we have a letter in the collection which confirms that Bell was the model for Sherlock Holmes. So surgeons have been involved in lots of different things, and we have the specimens, but also these other people that are all linked in with history, certainly with the history of Scotland, but also internationally. And I think Scotland internationally has been important with the development of medicine. So, for example, at the Edinburgh University started in the 18th century and very rapidly became a centre of excellence for medical learning, and that spread throughout the world. So it's a pretty significant place for the development of medicine. This, along with the university, probably the two main institutions in Scotland.
How were these specimens, or a lot of the things here, collected? Are they things that were donated, or are they things that were here from the beginning?
Certainly in the late 17th, 18th century, people operated on other people and took the bits that they that weren't going to be any use anymore and put them in a jar because they were fascinated with the condition, and also understanding of the human body was not as good as it is now, obviously. So in those days, there was no real permission given. The stuff was just taken and put in jars, and people individually developed collections. And part of the reason for developing collections was so that you could teach or set yourself up as a teacher, and there was money in it. I mean, if you had a big collection of curiosities, then people were more likely to come to your lectures because they could get a fuller understanding of what they might have to do. And it wasn't really until the 20th century that there were controls over what you did with the human body. And certainly, I talked about Burke and Hare, but as a result of Burke and Hare's activities, the Anatomy Act came into being in 1832 in England, which meant you could no longer just take cadavers and deal with them as you like. So there were rules began to be enforced. And certainly in the 20th century, we've had several bits of legislation that have controlled that, so that now the museum is governed by the Human Tissue Act 2006 in Scotland, which means we have to take an ethical consideration of how we display our objects as well. So it's been a kind of incremental process about how people have collected them and why they've collected them, but we are now at a stage where the human tissue collection in this college is closed, so it stays as it is. And as you can see when you go around, there have been lots of different ways of preserving. There's lots of things preserved in jars, normally in something like formalin, or in the older days it was spirits of wine. But they've been preserved by injecting them with wax, for example. And there are examples of hands and feet, which have been injected with wax, coloured wax, to show the veins or the arteries, and then they've been reduced in some kind of corrosive substance to leave just the wax network around the bones, which makes a very beautiful, in a way, preservation. And you also see this with kidneys and things like that. You actually see the structure, and it really is an amazing thing to see the network of the human veins and arteries around a hand or around a specific limb or organ.
Now, you brought up Burke and Hare.
Yeah.
After Burke was executed, he was publicly dissected, which
Yeah.
is kind of fitting for his crime.
Yeah. It has a very... I think it was certainly seen as a punishment, and I think you've got to remember that religion played a strong part in people's attitudes, and anything that sort of, affected the way your body went to its final resting place was particularly worrying, and dissection was seen to be almost a fate worse than execution in some respect. And I have an interesting little story about the famous Scot surgeon John Hunter, whose name is associated with the Hunterian collection in London, but also there's his brother started the Hunterian collection in Glasgow. But John Hunter was fascinated with the human body and was very keen on collecting the remains of various either stunted or overgrown individuals, and one particular individual was an Irish giant. He actually approached and asked could he have his body after his death, and then normally when giants, it's an enlarged or a problem with the growth hormones in the body, he would probably die about aged 20 odd. And Hunter asked him if he could buy his body, and the gentleman concerned was shocked and horrified. So he asked his friends to bury his body at sea. And he duly died, and Hunter came to an arrangement with the undertaker to take the body, and they filled the story is that they filled the coffin full of rocks, and the friends dumped the coffin over the side full of rocks. That's the story, but it just demonstrates how concerned people were to preserve their body intact after death. I mean, there are lots of books and theories been written on why that may be, but certain religion played a strong part in it, so it was certainly seen as a punishment. And executed criminals were considered to be fair game, and certainly prior to 1832, Edinburgh Town Council would provide the college with normally about a body a year. It was very, very little, and considering the number of people that wanted to teach surgery, it wasn't enough, and therefore people resorted to other means, and the term resurrection men came into use, which is people would go to graveyards at night and steal bodies to supply surgeons and teachers and practitioners with something to demonstrate on. So it was a kind of very widely spread practice. I think the Burke and Hare tragedy really meant that once and for all a law came on the statute books which was intended to stop that sort of behaviour. So it's a very strong link between religion, death, the use of the body, and there was a tension between how we understand our body, how we learn about it, and how we acquire the means to do that. And I think that was always going to be an issue.
And do you have a number in terms of how many visitors you get?
Yeah, we get about 30,000 visitors a year. It's a bit shocking, some of the things you see here, and you think, God, that's really, some of the stuff is quite outrageous. But within 3 or 4 days, you realise that actually it's all part of the human body. And I think the thing that struck me is how people have lived with some of these conditions, and the most shocking one, which is not on display for me, is almost an entire head in a jar, which is unnamed but was collected in about 1811, and it's a chap who had 2 very, very large facial tumours, so much so, it looked something akin to the Elephant Man, if your listeners know who that is. And it is still quite shocking for people to see it, and I worked with some artists on a project to look at that. But what I enjoy, and I think, is the kind of taking of something like that and turning it into something that people then begin to appreciate and reflect upon, and then maybe come back and do something else with it, and word goes out and you get other people coming in as a result of that. And I think it's that sense of influencing people's interest is probably the most satisfying part of this job.
That lays a good foundation for what the museum's all about. Now let's go inside with Jesse Merlin and explore.
Well, yeah, that's the thing. Dr. Hill is a brain scientist, and I have a scene where I do an autopsy on a cadaver and pull a brain out of the skull, and so the museum is located on Hill Square on Hill Place, which is just perfect. And you come in kind of through a inconspicuous second floor landing on a back doorway and find yourself somewhere between kind of a hall of horrors and a really fascinating modern museum.
Are there some favorite points in this exhibit that you'd like to?
There's a lot of things that inspire me. This is really interesting. These early anatomical displays of hand and foot, I think they fill the blood vessels with mercury and other liquid metals to get them to hold their shape, and the whole process of what was the word? Like maceration, the way they strip the flesh from the bones, and the way they preserve that is really.
Tell us what it is.
It says Injected and Varnished Dissection of an Infant by John Barclay, who was, I think, one of the first directors here at one of the first major collections of comparative anatomy here at the museum. But yeah, it's quite quite shocking. It's kind of in a standing, almost proud position, and you can see how it's been varnished, and it's had its different organs prepared and filled with different heavy metals to preserve it for display and instruction. And I think that's one of the things you feel keenly when you come here, is that whether or not they did it voluntarily or they did it intentionally, countless numbers of people have made quite a sacrifice by being included with this collection and contributing to the understanding of medical students for hundreds of years and hopefully well into the future. I mean, it really is. It's the same sense of gravitas and kind of solemn respect you have to have in an old cemetery. I mean, but these are people who really have contributed a lot. This is also something I was describing. These are different, 4 different examples of broken leg bones here, and broken foot. That were badly set or not set at all, simple fractures and compound fractures, and you can see the kind of really extreme deformities that came out of it. It's hard to imagine how people would walk, just with great pain, those who were able to survive long enough to have their legs heal. And just something as simple as a modern bone setting is something we really take for granted, don't think much about. What I find interesting is just how gruesome the whole history of surgery is, until we get to Lister, really. Besides a few advances in amputation and wound dressing, which was pretty dodgy to begin with, and also there's a lot of bloodletting in this country. Until they understand the cleaning of wounds, the cleaning of instruments, and the basic nature of microbes and infectious disease, there's really not a lot to brag about. I mean, even if you had a gangrenous infection amputated, you'd still get at best a 50-50 chance of survival. So,
the other thing I thought was interesting too is the fact that there were barbers, surgeons.
Right. Well, but, and the word barber had a different meaning than what we think now. Have a tooth pulled, get some trepanning or bloodletting done, have some leeches. Yeah, barber surgeons. It's kind of a frightening idea. Yeah, there's a lot here about military injuries. Yeah, this is the femur with a gunshot wound in the side of it preserved in alcohol. And, it's a really interesting cross-section. They have similarly preserved faces from the First World War, a lot of preserved stuff from the Crimean War and other things like that. More stuff over here. You can see entry and exit wounds of bullets from Highlander killed at the Battle of Culloden, 1746. Entrance and exit wounds made by Hanoverian musket ball. And over here, the whole range of different kinds of ordnance that can end up in your body or stuck in a bone. This one is really fascinating. It's a bunch of saber strikes on the top of a skull of I think a French cavalryman killed at Waterloo.
Can you describe what this skull looks like?
Yeah, this is just the top section of a skull of a French cavalryman killed at the Battle of Waterloo, and it has a bunch of angular, fairly deep saber cuts. So presumably he was struck maybe even while on his horse over the top of the head, and could easily have died from blood loss from these injuries. But I mean, it's not just the injury that's interesting; it's where it falls in the place of history. You see, particularly with a lot of the compound fractures and bone injuries, that until basic modern techniques in bone setting were understood, things would heal in really grotesque and deformed ways. And I think one of the things that's interesting about having all these pathological specimens from the 17 and 1800s is a lot of these diseases and conditions simply don't exist in the modern world. So the only way we can study them is with very old specimens. And there are some things that they can be proud of here, too. This is a fella here who actually was an accomplice. We'll get to the Burke and Hare case, a very famous grave robber and body snatching murder case from, I guess, the 1820s. One of their accomplices or companions had a very deformed mouth and neck from a burn injury, and so they would take casts of a gentleman like this before surgery to improve his condition, and then after. So here you see him before, and I think somewhere else you can see his improved state. The stuff of probably endless film adaptations and gory stories is Dr. Robert Knox and the case of grave robbers and murderers Burke and Hare. Robert Knox actually has quite a connection to this place because he was the first conservator, I guess, of the Barclay collection and conservator of the museum here in the 1820s. So he was a lecturer on anatomy and a very famous doctor and scientist. And in this time, they were guys in his profession were constantly in need of fresh specimens, kind of like Herbert West in Reanimator, not for experiments bringing the dead back to life, but for dissection anatomical lectures. And it was a largely unregulated practice of where they would get the bodies from, and there was a rather high premium paid for fresh bodies. So barring the fairly irregular execution of a young healthy specimen, when they'd be guaranteed the body, there was a very frequent need for it. And Dr. Knox was never directly implicated himself, though he was tarnished by the scandal that two men who had been providing him with bodies were not only robbing graves, but they were actually murdering people and bringing them in fresh and unmarked, probably smothering them so it would be particularly obvious that they'd been murdered. And this went on for quite a while until they were caught. Hare went Queen's evidence against Burke, and Burke was hanged for the crime. And we have the death mask casting of Mr. Burke here. You can see the injury on his neck very clearly. And among the other gruesome parts of this collection is a pocketbook supposedly made from his skin. Feeling against these men was very high. It's hard to imagine that one of them was actually allowed off for turning Queen's evidence. But this kind of led to the downfall of Dr. Knox. He was never criminally tried himself, but he lost his position, and it really brought a lot of shame to the occupation and to the hall here. And I think it was about 1832 they had to bring in an act strictly regulating the sourcing of dead bodies. One thing that's worth mentioning is if you go to Greyfriars Cemetery here in Edinburgh, you see several examples of things I've never seen in the United States. I don't know if they exist anywhere, called mort safes, which are iron cages placed over graves to prevent body snatching. People were so worried about it, they would place over a tomb or a small crypt an actual locked, grilled iron cage on top of it.
And one other thing I was curious, I don't know if you looked into it or if you could just mention it, but it points out that he was publicly dissected, which seems...
Yeah, there's kind of a full circle there. You can imagine the level of prurient interest that went around that public dissection. I don't know the details of it. I wonder if it was just restricted to medical students or families of the victims, kind of like watching a modern execution. You can see a contemporary print showing his hanging and how many people were there watching and how closely followed it was.
That seems like a kind of a fitting end for him, considering what he did.
Yeah, it really is it's the kind of the stuff of legend here. It really is kind of almost like Disneyland, or Mr. Lincoln talks about America here. They've got different wax figures dressed in period costumes in their the reconstructed offices of the famous doctors here. We have Robert Knox here in a rather dashing purple Regency-era coat, which is accurate down to his sideburns and his cataract. And it has a lot of, to the modern eye, the rather grisly parts of his collection here. I mean, simple stuff like his violin, a deformed skeleton, a kind of half-dissected and varnished child skeleton in a case, and another deformed skeleton over there.
Not what you see in a modern doctor's office.
Though why I can't tell. Oh, here, I think this is interesting. The gentleman, I believe, is this what I'm thinking? The accomplice to the Birkenhair crimes.
Oh.
That's him. That's his deformed face, I think. So they have a wax casting of his deformed face, and then they actually have his skull here, I think. Yeah, John Brogan. It was one of the accomplices of the murders. And I guess they have Burke's skeletons somewhere else nearby. This is interesting. As we get into the modern era, it gets a lot more impressive. There's a lot more to be proud of, particularly with things like the development of anesthesia. And they have a lot of the original devices, which were some of the first used. Something that almost looks like a old-fashioned oil lamp combined with an asthma inhaler. It was almost like a hookah that you would breathe through. Nerve compression for removing the sensation, probably mostly prior to amputation. Rather grisly obstetrical forceps here.
Some of the stuff actually looks like torture tools.
Yeah, this is a very well-preserved alcohol specimen of a compound fracture of the leg, and you can see, I think that was amputated due to gangrene. Severe comminuted compound fracture with the tibia and fibula both broken in 2 places. Oh, this is interesting. This is the very beginning of antiseptic technique where they talk about carbolic acid. That it's funny, Lister was, I think he was involved with using it to clean out the sewers, and it was where he had the idea for dressing wounds and sterilizing instruments. It immediately had a huge increase in the survival rate of his patients. Yeah, the Lister exhibition is probably even bigger than the Conan Doyle exhibition here in terms of something they're really proud of. Here we have Dr. Lister in some of his actual clothes, kind of like Madame Tussauds here, with a photograph of one of his operations in the background. And this is an early, I think, cauterizing instrument for that he actually used to sterilize his surgical tools. This is an actual bench from his infirmary that they allow you to sit on here. So, I mean, it really is living history. More of his clothes here. I love 19th century frock coats. It's beautifully preserved stuff. And then all of the gold medals and silver trowels he won. They were very happy with him. If you think about it, he probably saved more lives from his discoveries than, God, probably most doctors throughout history. This is particularly interesting to me, playing Dr. Hill, as a brain scientist, because this is a cross-section of a brain where they operated on the patient in 1884. Yeah, this is one of Lister's unsuccessful operations. He opened the skull to try and relieve an abscess, and you can see the large, probably walnut-sized abscess here in the brain. And it looked like it was going to be a success because he did gain some of his eyesight back and seemed to recover. But, I mean, God, the fact that they would even attempt open brain surgery in the 1880s is pretty amazing. He did die about 10 days after the operation, but they have the inflamed and abscessed part of his brain preserved here. Yeah, and this is where we start to get to the more gruesome preserved specimens here, like a gangrenous foot. A lot of things that were preserved after amputation. Yeah, fibroadenoma of the breast, really things you just, as a layperson, you're never going to see inside this kind of a condition or inside these kind of wounds, unless you're looking at pictures on the internet. If you are morbid or gruesomely inclined, but these are really things, as old as they are, presented in an educational way for serious students and lay people alike.
we're about to enter the pathology hall, which is where we get the really, really juicy stuff, so to speak. I was mentioning earlier the hinc sanitas, which is Latin for from here health. The sigil or medallion or escutcheon or whatever you call it, the symbol of the university is really beautiful and full of meaning. And it starts with a little scroll at the top that says hinc sanitas, and has the sun kind of dispelling the clouds of ignorance, and above it we have the knight's helmet, which I think is related to the royal charter. On either side of it we have Aesculapius with his staff with the snake, which I think is the source of the doctor's caduceus, the double snake with the staff that you see doctors wear even now. So Aesculapius of Greek myth. Over on the right we have Hippocrates, looking very austere, reading his book. And then all these details here, we have the St. Andrew's cross with the crown of the thistle, which is the sign of Scottish royalty, the Scottish charter, all the different grisly instruments of the trade of surgery, a hand with an eyeball in it pointing down from a cloud, which is great. This is the kind of the symbolism of the seeing hand of the surgeon. Then a body on his side, and underneath that the castle, which represents the city of Edinburgh. And I think at the bottom it's a bunch of medicinal herbs and roots. So usually you're going to see this kind of a symbol, no bigger than the size of a quarter, but it's absolutely full of meaning. And over here we have a preserved snake, and then a couple of Greek-style clubs with the snakes of Aesculapius. And I gather in the past they used to have quite a collection of preserved animal specimens, which were all taken away because they're not really used. In the post-Darwin era, comparative anatomy between animals and human beings is less instructive, I gather. But they do have a few things left. There's a gigantic elephant skull as you come down the stairs. It's worth a look. So here we get the more preserved stuff, and it starts to describe the way they preserved things at the time. Tissue preservation with mercury by injection through the blood vessels, really you end up with something very colorful and very, very vibrant looking. The problem with preserving tissue and alcohol is that certainly after 100 years, most of the pigment is leached out just by the nature of the fluid. But I mean, here's something as delicate as like lymph vessels can be preserved through mercury injection and hold their shape even 100 years later. This is more modern. Acrylic corrosion. So they inject the blood vessels of a normal kidney with colored acrylic to show the circulation. That's more modern and very, very colorful. This, I think, is really quite remarkable. This is, what year is that? The right hand and wrist dissected to show anatomy of tendons and blood vessels, preserved with wax, actually. And you can really get a sense of the way the hand articulates. And then the older way of preserving organs is through, like I say, dry specimen preservation with, injection and drying and varnishing. Oh yeah, here we have another about circa 1800 child skeleton. And I always wonder how they settle the poses for these poor little guys, because he almost seems to be standing with his arms up in the air and his torso open. It's very expressive. Like a little fellow like this never had a chance at life, but in a strange way has immortality here as a teaching model. So not to be vulgar about it, but as I said earlier, this is, as we enter the pathology hall here, this is Dr. Hill's classroom and Hannibal Lecter's kitchen. And, I'm playing a neuroscientist now, and I'm playing Hannibal Lecter in a month in another musical, so it all ties together for me. It's kind of a theme here. Here we have a series of wax models of fetal development, and some even oversized models showing the development and kind of natural division of the egg, much enlarged. And it's very hands-on. They have a lot of preserved slides that you're actually able to examine through a microscope yourself. Yeah, there's quite a few cases here of tools for amputation, which are really grisly when you think that, particularly the 1700 stuff, they really don't have anything approaching a modern anesthetic, and at best they can just try and use a tourniquet to cut off the blood flow and hold you down and put something between your teeth and just saw away as quickly as possible. I mean, some of these things just look like woodworking. A hand saw. The shape of some of the knives is something you really never see for anything except amputation. A lot of very grisly color diagrams here of the time. This is pretty extraordinary. This is a dissection of an entire adult head from the mid-19th century, and it's been designed in a glass case, kind of lacquered and varnished and prepared with different waxes and mercury injections to show the distribution of facial nerves, which is actually a very interesting way to look at it. You can really see, they're color-coded. The white nerves are the main nerves, and the smaller branches are colored yellow. And I forget where it happens, but there's a description here about how the understanding of nerves develops once they understand the difference between the central and autonomic nervous systems, how different parts of your body are controlled by different nervous systems. I think besides Lister, their most famous native son here in medicine is, of course, Conan Doyle, who actually went to university here. And his instructor, Joseph Bell, he was principally the model for Sherlock Holmes. I mean, there's a case to be made that there were a few other models too, but the way Dr. Bell trained his students to look for a disease as you would recognize the face of a friend in a crowd, and be able to recognize him instantly, in the way he would assess people, just on first look, down to their occupation and their age and where they've lived and the different diseases they've had, really ties in with Sherlock Holmes. And there's a whole exhibition here and a little video of Conan Doyle from the late 20s talking about it. Here we are back in Dr. Hill's territory with cross sections of skulls with preserved fractures and abscesses and different blood clots in the brain. Sometimes there's a piece of the skull preserved in alcohol, sometimes a whole cross-section of the organ itself. You can just see how severe a lot of these head injuries were in the days before any kind of meaningful brain surgery. All they could do was examine it after someone was dead, preserve it for analysis. And I mean, just the size of this extradural hematoma on this preserved brain here in yellow fluid is, God, the hematoma is probably the size of a pear.
And some of these have like the holes drilled that
you can see the evidence of the surgery. Of the surgery and the healing. Let's see. Yeah, different evidence of a hematoma inside the brain, evidence of a laceration cut through the skull. Hernia in the brain. God, that's an unpleasant thought. And then, of course, something that, again, is not, one of the things I love about this museum is that they present the history of surgery very, very honestly and very openly, and they don't really pussyfoot around the more unpleasant or embarrassing parts of history. I mean, they have quite a few trepanning drills here on display, and a fractured skull here with 2 holes drilled for trepanning. See. I guess trepanning is still performed for certain kind of operations, but they'd use a power drill now. what does it say here? Although this procedure may seem to be a dramatic modern response to relieve raised intracranial pressure, there is evidence from archaeological remains that prehistoric people also performed such procedures. Well, that's true. It doesn't necessarily mean it's sensible. Oh my God, just the size of these bladder and kidney stones is really unpleasant. Some are the size of everything from cherry pits up to large stones you'd find on the beach. This is calculus from the bladder. That's the size of about a billiard ball. And it's there's a whole display here on the treatment and removal of bladder and kidney stones, bladder calculi, which is, is something that's treatable now, but caused terrible suffering and pain and infection and death, and a lot of people we remember now, mostly great creative minds of the 19th century. Many of them were felled by something as small as a kidney stone. Yeah. This is an interesting skeleton of a woman who underwent an early cesarean section. This is a fully articulated mounted skeleton, and it demonstrates the condition osteomalacia. Yeah, boy, it has a really extreme deformity of the rib cage. It's almost squeezed, so the proportions are inverted, where it's thicker, pointing from the center of the back out toward the front, and squeezed and pinched between the arms. A lot of these deformities of the bone are caused by gross nutritional deficiency that's better understood now, so you really aren't going to see these, certainly in the developing world. It would be extremely rare. But this woman actually underwent a successful cesarean section. The child survived, but she died afterwards. So I guess that means it wasn't entirely successful. God, look at that picture of this. Here's an illustration of an ovarian cystadenoma from 1872, and it shows a woman with a benign tumor from her ovary that's grown to about 2 or 3 times the size of her entire body. And some of this stuff is really quite shocking. The heart stuff is pretty remarkable. They have preserved aneurysms, preserved arterial aneurysms, all sorts of different aortas in various states of preservation. You can see if they've been set in a kind of an acrylic block. They have a lot of color. If they're still in the liquid, most of it's gotten leached out. But that's one of the things when you come here, you really have to check the schedule, because the pathology hall is still used for exams. I mean, it really is part of the schooling of all of the students here at the university. Yeah, here we have some uniforms of different casualties of the Crimean War. It's something, and let's walk down here. Mm-hmm. The part here about military surgery is fascinating, because in a sense, military service was a great equalizer in a time where society was even more stratified and class divided than it is now. Almost always in times of war, men from all classes had to serve, and even if you were in the officer class, it was no guarantee you weren't going to have some gruesome battlefield injury. So there was the value of surgeons on the battlefield was immense, and your chances of survival from even what we would now think of as a very simple injury were pretty slim, if there was any chance of infection. Here we have a few examples of musket balls preserved in amputated legs. Here's a skull with a very deep saber cut from the Battle of the Pyramids in 1798. Quite a few fractured bones with the pieces of musket ball and other ordnance from the Battle of Waterloo. A skull with a musket ball entry and an exit wound.
It's pretty impressive that they were conscientious enough to save a lot of this.
Yeah, Yeah, well, and something that you don't see, there's a separate gallery of the paintings, but they have also, especially in the era before photography, they have a large collection of rather depressing paintings of the progression of wounds and infections on the battlefield here for instructive purposes. I mean, this is not the kind of art anybody would want to hang in their home. And a lot of it, there's a whole story behind it, like this musket ball wound and this soldier's upper arm, and it's humorous. It says in this sketch, the apparently trifling nature of the wound is represented. In this sketch in oil, the apparently trifling nature of the wound is represented. Through such a wound, however, the finger can be introduced. And just think, doctors were sticking their fingers in wounds without washing their hands. I mean, and they're writing about it, right? So, through such a wound, however, the finger can be introduced, and if the bone be shattered, and in this instance, jagged points of the fragments will be felt all around. The observation made to me is that when the bone is, if the bone is broken, we don't have to amputate, but when it's a compound fracture and fragments are sticking through the skin, it's a candidate for amputation, and I'm pretty sure this guy did have his entire arm amputated later. Yeah, look at the sketch in oil of the state of arm of an officer 2 years after a gunshot fracture. And the poor man still has his arm, but he's suffering with terrible suppurating infections. I guess this is about 1820s. It's from the Battle of Corunna. Here's a beautiful collection of, hand-decorated porcelain dishes that were all used for bloodletting. So there's a lot of that in the history of this city. Well, here's some interesting stuff about Army and Naval Service. This is pretty wild down here. This is a preserved tattooed chest of a sailor. I'm trying to remember if it says exactly where he's from, but it looks like it might be even a 17th century sailing vessel with snakes and birds and a beautifully articulated and designed ship on it, and the color and pigment is really in quite good repair, quite good preservation. Yeah, this is pretty shocking. This is a rather extensive skull wound of a gunshot at Waterloo, which, if you can believe it, the patient survived this injury for many years. And it looks like there's a chunk of bone about the size of an apple removed from the upper forehead through to the top of the scalp. So this man, and it's very jagged. So this poor fellow was going through life with a large hole in his skull for quite a while. It's amazing what the human being can survive. I almost feel embarrassed to comment on this stuff because I just feel like I'm going to expose my ignorance. I'm really only a layman, and I won't say enthusiast, but just someone who's, interested in the history of medicine, and particularly medical field practice and military service. Yeah, here we get to more modern kinds of injuries. Some rather gruesome examples of amputated feet suffering from trench foot and gangrene. Really kind of interesting cross sections of rather cleanly preserved lungs in liquid, with still a lot of color, suffering from gas gangrene, a kind of injury, just a horrible lingering injury to the lungs caused by mustard gas. This is one of the most, I think, moving specimens here. Is a gunshot wound which entered the skull through a wound on the left side of the nose, and a large piece of the man's face has been preserved. And you can really get a sense of the character of the man because he still has his mustache and eyebrows and eyelashes and the pigment of his skin. It's about a rectangular sized section of the face from above the eyes to just below the lower upper lip, and it's stitched, but it shows the entry of a terminal wound through his nose. Yeah, and this is something you see a lot here, donor unknown, which is a polite way of saying, who knows if this man had any intention of giving up his body for medical science, but it's a pretty profound contribution, and one that you can see even if you can't come here. The catalog that they sell, which is the Surgeons Hall history, which is an overview of the history of the hall with a lot of pictures of their more unique and or historically significant specimens, is definitely worth owning. Yeah, here's a rather shocking piece of the skull from a World War I. God, that's got to be a shell wound. No, it says gunshot. It's a large gunshot wound that went through the top of the skull. It caused, I'm sure, terrible swelling, and then they had to do trepanation. So, I mean, the gunshot wound is about the size of a silver dollar, and or maybe that gigantic hole is the gunshot wound and the trepanation is the smaller hole. It's kind of hard to tell. But a lot of the skin and even the hair on the scalp is preserved. Yeah, the field surgical sets for the First World War are pretty remarkable, and in a lot of ways it's not that different from surgical tools today. Though how they would have kept them sterile and cauterized, I can't imagine, especially in such grim conditions. Anterior portions of a cerebral hemisphere is a preserved brain with a severe gunshot wound from the First World War, a man who died a couple days after the wound, but you can actually see preserved in the path of the bullet chunks of bone that had become lodged in his brain, caused bleeding. Pretty vivid and still full of color. And a lot of these preserved wounds here from the First World War show very clearly the nature of the wound. There's an entire preserved stomach here in liquid that has a long white rod showing the entry and exit of the bullet that presumably contributed to a fatal wound. We have a kidney here. It's preserved in color, but black with preserved hemorrhage. This is an interesting example of a cross section of a lower leg showing the affected gas gangrene on tissue nowhere near the lungs, and it's a rather remarkable effect on the whole body. Yeah, the skull here shows pretty clearly the effect of a high explosive shell, which is really a very different kind of wound than an entry of a bullet. It's almost like someone set off an explosion right by the skull. Very jagged.
Why don't you explain what you're seeing on the third floor?
Well, by the way, the gallery here is quite beautiful. Example of, gosh, what is this? Like Georgian architecture. It's beautiful skylights, and it has little alcoves with different themes for medical display. But the second floor, or what I guess they would call the first floor here, is absolutely just crammed full of cases of pathological specimens. A lot of the jars don't even have lids, and that's not open to the public. It's a whole vast bulk of the collection that I think is very specifically used for medical students, and hopefully you'll get a look up there tomorrow, because they don't really let people up there. It's very special. An interesting case here that has the growth of the fetal skeleton, and it has the fetus through all the different stages of development. And it's funny, I think it kind of shows the bias of the era. I'm not sure when most of these specimens are dated from, but they're all articulated and standing. And of course, you know, understanding the way fetuses develop, that's not the way they would look. I mean, if they were either miscarried or aborted or however, or stillborn, I mean, you were not going to see a fetus in a standing position. But I think it kind of shows the prejudice of the time, as we like to see our skeletons looking the way we look. Yeah, this collection of skulls here is quite remarkable for the deformities and I think some genetic disorders, but particularly disorders related to extreme malnutrition, things you just very, very rarely see now. I think some hydrocephalus skulls where the cranium is almost looks inflated like a balloon to, I'd say, 3, 4, 5, 6, 7 times its normal size. And then some of the more proud parts of their, I guess, early surgical history is pre- and post-operative facial casts in wax and plaster of a facial tumor by Dr. Liston. The life stories of a lot of the doctors involved with this place are quite remarkable. He was really popular and quite brilliant. But you figure in 1834, this facial tumor that has swollen on the side of this woman's face to almost the entire size of her face. I mean, it's quite close. It's really extreme. A simple injury that just swelled into a grotesque, oversized tumor he successfully removed from her. And then we have the casting to the right of her face post-surgery as it heals, plus a separated cast of the tumor, which is pretty shocking. I mean, it's bigger than her brain. Though I shouldn't get too excited about it because it doesn't say how long she survived after the operation. Oh, this is interesting. Some of the collections that have come here, this is the Alcock collection, just a number of preserved pieces of amputated legs, mostly with the musket balls actually still stuck in the bone, either lodged in there or preserved in position, really showing the nature of the injury. And you can see the various attempts of the bone to heal itself before amputation was called for. A lot of musket ball injuries and pieces of preserved skull. Some evidence of trepanning holes. One of the most interesting pieces of forensic pathology here is a preserved series of specimens from a murder case. And unfortunately, they pulled down the description, but it's in the printed catalog. And it was a man who stabbed his wife and killed her. He stabbed her in the heart with a shoemaker's knife, and they have different pieces of it, presumably used in the trial before they were donated and preserved here. But they have the punctured skin, a punctured tissue, the actual knife used to commit the murder, and then the preserved punctured heart. So, again, it's not exactly the right expression, but it is a form of living history. You can see, the criminal act, and then it's the different way it was examined and preserved in use for the trial, and then the way it's been preserved for less anatomical display, but to show the way forensic, particularly the early days of forensic pathology. No, it really is. It's emotional being here. It is an amazing collection. It's not that popular a museum. It's a fairly inexpensive museum. It's only £5 to come visit. But you really are overwhelmed with a sense of just not just the sacrifice, but just the individual tragedy of a lot of the people on display here, because for most of human history and most of the 500 years that there's been a College of Surgeons, a simple injury, a simple infection could kill you or disfigure you or cause you to suffer just terribly. So, we of the late 20th and early 21st century, so much of what we take for granted is just a blip in the scale of human history. Just the ability to have a wound dressed, the ability to have something, a broken bone or a cut on the skin not end up costing you a limb or your life. Also, I should say that really, I don't say lightly, but the gruesome selection of preserved cross sections of different cancers of all different parts of the body is the most cautionary thing I've ever seen. As an ex-smoker, I don't think I could ever pick up a cigarette again. It's one thing looking at a picture on a pack of cigarettes, but actually seeing large pieces of preserved cancer will make you think twice. It's funny, visiting here is an emotional experience, and for the characters I play, it isn't. For Dr. Hill, as a neurosurgeon and autopsy performer, he might as well be sawing a piece of wood in half. He absolutely has no nostalgia or feeling for a dead body. And I don't think that's necessarily because he's sociopathic, though he is. I think people who work with the dead, there must be a level of detachment you form at a certain point. Stuart Gordon, the director of Reanimator the musical, talks about spending time with the coroner in the Cook County morgue preparing for the movie, and just the really kind of almost to an outsider demented sense of humor that coroners and morticians have to develop. He says they're very happy to see people. They don't get a lot of people coming to visit them, so they love having visitors, and they're really pretty jocular and lighthearted about what they do. And I suppose in a sense you'd have to be. I mean, gosh, you read in the catalog of the Surgeons Museum. It's a beautiful catalog because it's not just the history and it's not just a bunch of gory pictures. It's poetry, modern and historic poetry on the subject of medicine, and reflections of students in a time gone by and modern students. And one of the students writes as recently as the early 80s. In your basic anatomy class, they're passing around a brain without gloves, and you're sticking your fingers in it and feeling it, and that's the way they dealt with dead bodies, which in the age of modern disease is really hard to believe. I'm sure they still do pass out brains, though I think you'd probably have to wear some kind of gear to handle them. But,
Thanks for listening to the KPBS Cinema Junkie podcast. Jesse Merlin can be seen later this month in the new film Helen Keller vs. Night Wolves, a horror film designed to be bad by the maestro of modern bad cinema, Ross Patterson. The film will be streaming live on Halloween on Dread Central, so check it out. Merlin also played Werewolf Hitler for Patterson in FDR American Badass. And keep alert for Reanimator the musical because it has a way of, reanimating. Remember to check back each Friday in October for a horror-themed edition of the Cinema Junkie podcast. You can also go back and check out last week's episode featuring Clive Barker. Coming up will be a discussion of psychology in horror with The Babadook, a behind-the-scenes look at Reanimator the musical, and an audio essay on the first films that scared people. So till our next Film Fix, I'm Beth Accomando, your resident cinema junkie. Please subscribe to the podcast on iTunes and help us out by leaving a review. The podcast is only a few months old, and we rely on your word of mouth to help us build a larger audience. Thanks again for listening.
KPBS On Demand is supported by UC San Diego's Art Power, presenting cellist Joshua Roman, performing from his album Immunity, alongside music by J.S. Bach and more, Sunday, June 22nd at UC San Diego's Epstein Family Amphitheater. Reserve your tickets at artpower.ucsd.edu.